I work in a wonderful hospital called the Evelina Children's Hospital in London, and I work as a general paediatrician, which means I cover everything from the emergency department all the way through to the high dependency unit. What I've been doing over the last few years is trying to find areas of that work that make patient experience below what one would hope for, and then see how you can do something about it. On December the 15th, I was merrily walking to work and I was crossing a zebra crossing, and a car hit me at rather great speed, which led to me fracturing lots of bones, some of them requiring operations, and then since then have slowly been recovering and rehabilitating. It's almost impossible to empathise or to guess what things are priorities for patients until you actually experience it. And that's given me a probably unusual opportunity to reflect on my experiences as a clinician and how those compare to my experiences as a patient. It's definitely given me an insight into elements of the NHS that work brilliantly and elements that maybe could work a bit differently. There are often people who've done little things that were really extraordinary, like the lovely gentleman who brought teas and coffees around and meals to the patients, who would remember what I liked in my tea and which particular biscuits I liked. They wash my hair. When you've spent 10 days in hospital and still have the road and all the blood and everything else in your hair, it's an incredibly different feeling when someone looks after you like that. I have never asked a patient anything about those kinds of personal cares, which actually are really, really, really important. One of the orthopaedic surgeons, when I was maybe 4 or 5 days into the hospital, came and sat next to me and he said, "Well, tell me what you're learning." And it was that curiosity which was so, so important and will stay with me for a long time. I really, truly believe I will go back and be a better doctor and hopefully a better supporter of healthcare as a result of my experiences. And for me, having worked abroad, it was a really, really clear indictment of how lucky we are to have a system where I didn't wake up every morning in hospital worrying about how I was going to pay for something. I didn't wake up every morning in hospital thinking about what the long-term implications would be. I could just focus on getting better because we do have such an extraordinary system of nationally provided, free at the point of delivery healthcare.